good doctors. And whatever slides I send you is around 70 slides that will come for the examination. And you people should know my phone number. You can take from Brother Rami, such that you can give me any WhatsApp for any questions. Okay. So I'm here only. I'm the most senior most person in not even pathology, but in your whole medical school in Mataba University. So my principle is to give knowledge, not to just read for the exams. Okay. You should become good doctors. You're Madina doctors. So in that 70 slides, I added something that is not for the examination. For the examination, I already gave you 70 slides and you people have it. Now, I added many slides for your understanding of the mechanism of information. Okay. So first of all, I want you to buy this book, 11th edition, Basic Robbins. Okay. You should buy it. And this is the one, and it has a digital version also. And you should start reading it. The pages are not much. And this will be very useful for whole of your MBBS course. That is your medical school. Okay. Now, this chapter I'm taking only this one. That's all. Okay. And repair, I don't know who's going to take. I think cell injury, cell death, and adaptation finished. Now, this 1, 2, 3, 4, 5, 6, 7. This is general pathology. And if your general pathology is weak, you are a weak doctor. Remember. Okay. So read properly, read at home, ask me questions. I'm here to answer any questions. And this book is very small. It is ending in 775 pages, and you should be thorough with each and every page. It will be very good for your understanding of your medicine, surgery, gynops, everything. So we'll take the information. We'll go a little slower. And this is an additional slide. Don't worry. I'm just trying to introduce to you the importance of pathology. And as an example, I'm taking today inflammation. I think, Rami, are you recording this one?
Yes, doctor.
Yeah. Okay. Now, inflammation is the most important pathological process. It's very, very, very 100 times basic process. So it is actually the reaction of the vessel. We call it vascularized living tissue. It is the reaction of the blood vessels to injury. Okay. Inshallah, in the end, we'll have a nice session of question answers. If you want, you can ask me. Okay. So it is the reaction of the blood vessels to any local injury. And it's a very protective mechanism by Allah subhanahu wa ta'ala. And it's very non-specific. It is not specific. Inshallah, specific reactions we'll try to read in immunology and other areas. Okay. We'll try to read. For example, any inflammation. If you have inflammation of the appendix, it is called itis. Appendicitis. If you have inflammation of the soft tissue, as a yusamma, cellulitis. If there's inflammation of the meninges, we call it meningitis. Okay. If there's inflammation of the lung tissue, you have the yusamma, pneumonitis. Okay. Inflammation of the kidney, yusamma, nephritis. Okay. Inflammation of the myocardium is yusamma, myocarditis. This is only for your introduction. Okay. For example, now we'll see. This is the blood vessel. I told you, reaction of the blood vessel to any injury, yusamma, inflammation, or reaction of vascularized tissue, any injury. Okay, you know, this is the, suppose this is the skin. On the skin, we have a blood vessel under, and this is the lining of the blood vessel. Okay, this is the endothelium with the nucleus. You can see with the nucleus, and here is another one. So this is the blood vessel which is going on like that and continue like that, and you know the blood, the all these WBCs are flowing. Kurat Dambeda, okay, and even the small RBCs will be flowing, and you have a lot of plasma inside. Okay, you have plasma, you have proteins inside, all such things. So what is happening? Suppose there's a bacteria over here, okay, and suppose this is a lymphocyte and this is a neutrophil, maslan. Okay, this is a lymphocyte and this is a neutrophil. So this neutrophil has to come outside the blood vessel in the interstitial tissue. Okay, or you call it what you call it, tissue space. Okay, outside on extravascular tissue space, or even the lymphocyte has to come outside. If the neutrophil comes outside, has a yusamma, acute inflammation. Okay, if the lymphocyte or macrophages come, has a yusamma, chronic inflammation. Chronic. Okay, this is acute, it's very short duration. Chronic is prolonged duration. Inshallah, we'll read it. Don't worry. So these neutrophils and lymphocytes are coming outside. Suppose you have a bacteria, and they will come and kill the bacteria inside. Okay, and they will kill, and phagocytosis will be done. So along with this, what is happening? So you have you get the neutrophils and lymphocytes outside. For example, you take acute inflammation, you get the neutrophils plus the fluid inside. Shuf hada fi moya juwa, some are fluid, okay, and fluid also comes outside, okay. Now if you have the neutrophils, I'll just take it like that, okay. You have this one, okay, you have this one, this one, this one, neutrophil, lymphocyte, okay. You have the neutrophils outside plus edema. Edema is what? Collection of fluid, right? Collection of fluid. So you have all these things. Edema and fluid, you call this acute inflammation. Acute inflammation. Remember, inshallah, chronic will try to read it. So when does this inflammation occurs? Usually when there is infection. I'll tell you the causes. Or when there is tissue necrosis. Tissue necrosis, for example, in a case of, myocardial infarction, heart attack, right? Okay, what will happen when there is tissue necrosis? The blood vessels will exit. يعني يخرج برا the neutrophils mal fluid, okay, edema fluid, to what do you call, to clear this necrotic debris, okay, to clear the necrotic debris, okay, or to kill the bacteria or viruses. So that is why we need neutrophils and all such things to come outside, such that you start clearing the necrotic debris or eliminate the pathogens. It can be bacteria, it can be virus, it can be fungus, it can be parasites, anything. So what is happening? You people have learned the cell death. You remember cell death, they might have taught you. One is called necrosis, one is called apoptosis. Okay, apoptosis. So in all necrosis, there is always inflammation. But in apoptosis, no inflammation. You know that you already finished it. So when there is inflammation, why? They want to clear the necrotic debris. That's why there is acute inflammation. This will be cleared by neutrophils mostly, okay? So that they will destroy that tissue, and they start after when they remove this necrotic debris or the bacteria, then there's a repair mechanism will start, okay? That I'll not teach you. Inshallah, somebody will teach you in future. Repair mechanism, or we call it healing. Okay, this is very, very important to understand. Now, regarding this one, so acute inflammation is always immediate response, okay, and it is like an innate immunity, not an adaptive. It's an innate immunity, like our covering epithelium, mucin, mast cells, macrophages, which are very non-specific, right? So this acute inflammation is very non-specific. It is innate immunity. It is immediate. As compared to chronic inflammation, it is prolonged, and it is not innate. It is actually it comes mostly in the form of what do you call it, adaptive immunity. We'll try to read that afterwards, okay? And all this acute inflammation is mediated. Now remember, mediated by some factors. I will teach you in the end. These factors are very important, like chemical mediators and all such factors. I'll try to show you what are those ones. So this is all the little introduction to inflammation as a process. Is very important. Pathological process, very, very basic. It's a reaction of the blood vessel tissue or vascularized tissue to a local injury. It's a basic protective mechanism, a protective response, and it's very, very non-specific. Okay, we go now. You can see over here, this inside the neutrophils coming and trying to eat this bacteria, right? See again, a margination, rolling inside, adhesion, diapedesis, chemotaxis, and trying to eat this. This is a little video. In the end, you'll try to understand. I'll go forward. Okay, I'll go forward. Now, this is your first slide in what I have given you in the PowerPoint, which are supposed to read only for the examination. But here we are learning to know what is inflammation. Okay. Now, inflammation is defined as the local response of any living mammalian tissue or human tissue, okay, to injury from any agent. This agent can be infective bacteria, or it can be tissue necrosis, or it can be antigen antibody, anything, or a foreign substance or a foreign body, anything, any agent. So reaction of the local response of living mammalian tissue to injury from any agent as a yusamma inflammation. Okay. Now, for example, there's an injury here. So injury. Okay. You have an acute inflammation, that is the neutrophil is already outside. Okay. Now, acute inflammation, this neutrophils will will clear the necrotic debris or the bacteria, anything, then the tissue will become normal, resolution become normal. Okay, has a some resolution, or it will go for healing in the process of fibrosis. Okay, fibrosis. Sometimes it can form an abscess with sadi juva, pus juva. Sometimes it can become ulcer. Sometimes it can become a fistula. Sometimes it can become a sinus, or sometimes the acute inflammation can go into form chronic inflammation. In the end, we'll give some half an hour to chronic inflammation, which is again very important. So I hope you're understanding. I'm going very slow such that I want you to understand the mechanism of acute inflammation such that you people become a good doctor. That's my idea. Okay. So this is the basic area of acute inflammation. Okay, we go furthermore. This is your second slide which I gave you. Inflammation is distinct from infection. Now, lazim antum yarifun ma farq bainal infection or ma farq bainal inflammation. Yani, what is the difference between infection? Is invasion by any harmful microbe. This can be bacteria, this can be virus, this can be fungus, it can be parasite also. Okay, into the body, the resultant ill effects by the toxins, because these people secrete the toxins and they might cause fever and many other constitutional symptoms. What is inflammation? Is the protective response I told you by the body to variety of etiological agents. This can be infection, it can be tissue necrosis, it can be antigen antibody reaction, it can be a foreign body, anything. It can be infectious or non-infection. But you should know that inflammation is different from infection. Now, what are the stimuli of acute inflammation? Hada mohim jiddan. It can be trauma. Trauma can cause inflammation. Very important. For example, you're playing football in the ground, right? Rami is playing with his friends, and somebody, he has an accident, and Rami falls down, and he has a certain form of injury at the knee. And he tells me, doctor, I have this. I say, you have a lot of inflammation. All that area became red or something. For example, you have a trauma when you're drinking a tea. This particular thing will break, and you have a trauma. This is inflammation over here. It can be infection. It can be bacteria, virus, parasite, anything. It can be to tissue necrosis. I told you, as in myocardial infarction, heart attack. Okay, it can be like it can be a foreign body issue. It's becoming prick, and this area will become inflamed. Okay, as an inflammation. It can be immune reaction like hassasiyah, or it can be any antigen antibody reaction. So there are many causes of inflammation you should know, or you should know the etiology and causes of inflammation. Yani ma sabab al inflammation. So inflammation is basically a body's defense reaction in order to remove. Yani eliminate means remove or limit the spread of the injurious agent, followed by removal of the necrosed cells. Yani they should be eliminated, necrosed cells, and the repair mechanism should start. Repairing of the damaged tissue should start. Now, what are the important players? What are the players of inflammation? What we call this inflammation? We call this Quraat al-Dambada or WBCs. Okay? Yani Zay Jaish, yani Jaish. Zay army, yani army. Okay? Jaish. They are inside the blood vessels, I told you, and all these are running like that, and they have to come outside, right? Okay, all leukocytes are the major infection fighting cells, and these are the fighting cells which work as a jaish or an army, or the defensive cells rather than beta. Okay, now what are the types of inflammation? There are two types of inflammation you should know. Acute, I told you, even chronic, I told you. Okay, acute is very rapid onset. Okay, duration is very, very rapid onset, and immediate. Okay, nafsul waqt yani, and very short lived. It will go off within few minutes and it goes off. And the main cell, this will come in the MCQ in the examination. Remember, whenever I put MCQ, I'm going to put it in the examination. Remember, because we are the people who actually make the questions. So I can ask you, what is the most important WBC in acute inflammation? You should tell it neutrophils or polymorphonuclear leukocytes. Okay. And what is the other thing I told you? Even yakhruj barra al what? Moya. Edema is a characteristic feature of acute inflammation. Hada mohim jiddan. Okay. Then we go to chronic inflammation. This was rapid and this is late in onset. The duration is very slow, late. And longer duration. This is short-lived. Has a longer duration. It goes for minutes to hours to months, and it goes for, it can be inside somebody's lung or somebody's kidney for even months and years. What is the most, this is the MCQ, what is the most important cell for chronic inflammation? It has to be written lymphocyte or macrophage. Okay, now you should remember this one. The most important cell for acute inflammation is what? Neutrophil. MCQ. What is the most important cell for the chronic inflammation? MCQ is lymphocyte or macrophage. Okay, and this is very important. Granuloma formation. What is granuloma? Inshallah, I'll tell you when I come there. So today, inshallah, relax and have a cup of two coffees just on your table. Try to listen each and everything what I'm telling you. Granuloma formation is a very characteristic feature which is not present in inflammation. What is granuloma? Inshallah, I'll tell you. Okay, we go forward. Okay, now for example, I always tell my students that it's very, very important to understand what they are dealing with. For example, all my students, for example, you have sometimes you have your younger brother or sister have a tonsillitis, right? She or he will be very painful. Okay, now this is acute inflammation. Okay, usually caused by streptococcus pyogenes. All you people all know this. Okay, now this bacteria causes tonsil. So this itis means inflammation, right? Acute inflammation. Usually it is very rapid. Very rapid. By the time she sleeps in the night, she's okay. But by the time morning, your younger sister, 5 years, she gets up in the morning, cries, "Oh mother, I cannot eat. I know there is a lot of pain inside." This is the tonsil. It's very short duration. Okay, and lot of edema will be there. You can see. I'll try to show the figure. And the most important cell is again neutrophil. Okay, chronic, for example, you have a chronic, good example is tuberculosis. Okay, very, very important. It's a chronic process which is there for months and years. It is caused by mycobacterium tuberculosis. Okay, very late onset, longer duration for weeks to months to years. And I told you granuloma formation. Inshallah, I'll try to show you when I come to the chronic inflammation. And the most important cell in this is macrophage or lymphocyte. Remember, okay? Now, this is how we go, like that, okay? Now, for example, I told you like that. So now this is tonsillitis. There's an additional diagram to show you. See this one? Your younger sister, younger brother gets up, or even you can, this is all, even stopping the airflow. This is acute tonsillitis. Acute tonsillitis. Okay? Like this, just to show you, just to make you understand. This is all this red area. You can see inflamed area. All this is actually acute cellulitis. Okay, all this thing is acute cellulitis. Very, very easily you can get it. You want to see more diagrams, go to Google. Now this is acute laryngitis. In this also, your voice will go off and all these things are, you can see all this reddish area, all the inflamed area. This all becomes very, very inflamed because the WBCs are coming out of the blood vessels. Edema fluid is coming out of the blood vessels into the tissue space, into the interstitial space. Okay. Now this is you should know this. This is called inflammation. Okay. This is a chronic inflammation. Like you have this over here, this area. You can see this area. This is tuberculosis. Tuberculosis caused by Mycobacterium tubercle. Now this is very, very important. Tuberculosis. But this is a chronic inflammation. We go furthermore. Now this is one of your slide which is present in which I have give you. We have cardinal signs. What do you mean by cardinal signs? They are cardinal manifestations in the form of signs and symptoms. What do you mean by symptoms? Symptoms is the presenting complaint given by the patient to you as a doctor. Sign is something which you elicit in the patient. You try to see. So these are called cardinal signs of acute inflammation. Show Father Mohim Jiddan. Okay. In Latin, we should know the name in Latin and English also. So if there is that area becomes red, okay, that area becomes red, Hada Yusama rubor. Okay. The area which is inflamed, for example, I just show you this one. So Shufina, Hada red, sah? Okay, this is called rubor. Okay. And when you go and touch this area, it is hot. This is normal and this is hot. Okay, yani temperature more, sah? So this is called calor. This will come in the exam. MCQs, very important. If I write MCQ, that is going to come in the exam. Don't worry. Okay. Increased local temperature. Okay. Tumor and swelling. For example, You have this go back. You can see over here it is swollen up. Usually tonsil is like this. Khalas. Zekida. Now it is swollen. Okay. Now you can go and see over here. It's called tumor or swelling. And a varam. Okay. Now you have a, if you want to go and touch this area, they will shout. Huh? If you touch here, they will shout. If you touch it, so there's pain. Okay. Pain, 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 pain. Okay, pain. Alam mawjud. Okay. Other use some dollar in Latin. So if you pay. And there is loss of function. That particular area doesn't function. Other use some functional essay. Now these four things have been elicited by Celsus. This is a scientist. And this particular last is again a scientist which is called Virchow. This is the people who coined these terms. For example, you go furthermore, this is not there. This pain over here, there is increased temperature over here, there's a redness over here, there's swelling over here, there's loss of function. These are the 5 cardinal signs of inflammation. Now this is called rubor. Okay, this is called rubor, and increased temperature is called calor, okay. And you have this dollar is called pain over here, dollar, dolor. Okay. Now you have tumor over here, swelling. Then you have functio laesae. Now you should know this. Okay. Now, okay, this is what we have studied, and this is the acute inflammation of the tonsils, tonsillitis. I showed you, and now we are going furthermore. Okay. Now you can see over here very clearly that acute inflammation. Now this is one of the most important slides. Now Dr. Jundi, our physiology professor, wants you to study vascular events and cellular events very perfectly. Okay, that's why I'm teaching you today, because they want to teach the physiology in detail. So they want me to teach the vascular events and cellular events very clearly. So acute inflammation has vascular events. So you remember what was the definition of acute inflammation? Reaction of blood vessel tissue or vascularized tissue to a local injury. Local injury. So reaction of the vessel tissue to any injury. So what will happen? The vessel changes will be there, and the cells will also change. Now this is very important, very important. Now you should be thorough with this. Inshallah, I'll be repeating this particular slide very much. This we finished. Acute inflammation is vascular events and cellular reaction we finished. Now we are going to know what are the vascular events and what is going to change in the blood vessel caliber. Okay, and blood vessel changes, and what is going to happen to the cells like the WBCs. Okay, WBCs, yani kurada dambeda, yani neutrophils, all such things. Okay, now we are going to take this first. We'll take this and then we'll take it. Okay, slowly we'll go. And today you just relax and enjoy the lecture, because I want you to become thorough on each and everything. Now we will take vascular events one by one. What is the first event? 5 here and 6 here. The first one is transient vasoconstriction of the arteries. Antum lazim yarifun al-istilahat. Yani lazim antum yarifun terminologies, kullu terminologies. Next is progressive vasodilatation, persistent vasodilatation. Then we have an elevated local hydrostatic pressure. Mamana hydrostatic, inshallah, I'll teach you now. Then there is the vascular permeability. Yani tifta al kullu abwab, yani yakhruj al cells wa kaman moyaj barra. Okay? Min al dakhili, yani khariji ro. But then slowing or stasis. Now this is very important as the vascular event. Inshallah, in cellular events, we have 6 processes called margination, then rolling of the WBCs, then addition of the WBCs, transmigration, yani diapedesis, chemotaxis, yani yakhruj barra, but then phagocytosis of the bacteria or any virus, anything, or necrotic debris. These are the important events which are taking place, and this is the most important area of our lesson today. We go furthermore. Don't forget this one you have in your PowerPoint. Okay. Now this is what the one. This is the cellular event. So the cellular events I'll teach you in the end. You should know this one. See margination, pavementing, like that. Okay. Now see the margination. Then it's the rolling. Then the adhesion. Then yukhruj barra, chemotaxis. Then phagocytosis. Marathon ukhra. Shufina. Margination, rolling, adhesion, yakhruj barra, diapedesis, phagocytosis, like that. Okay. Inshallah, we'll try to see. Now, inshallah, what is happening to us? is this WBC has to come out. Okay, this WBC has to come out, and even the fluid which is inside has to come out. So there should be some changes in this particular gate. So the maslan has a endothelium. Endothelium has a zay abwab. Okay, they have to open such that this particular thing has to open, and these cells has to come over here. After this margination, they have to roll over there, and after rolling, they will form the adhesion. Then adhesion, they will go over here. This doors will open. Endothelium will form a space, and transmigration. Then chemotaxis will occur. Then they will go for phagocytosis of the bacteria or any necrotic material. That is the idea. Okay. Now this is present in your PowerPoint. Inside is being recorded, and we can, you want to hear again, you can hear. Now, as I told you this again, I repeat it. This is already there in your. The first is the transient, means very little time. Transit, like you have a transit passenger at Dubai, Zaikida. Okay, very little time. Vasoconstriction, yani, suppose this is the vessel, the constriction will be like this for little time. Okay, Mamana vasodilatation, suppose the normal vessel like that, then the vessel will become like this, dilatation. Now this is prolonged, persistent, yani istimrarian, progressive mode during asnal inflammation. Then what will happen? The third is called the hydrostatic pressure. Hydrostatic pressure is the pressure, hydrostatic pressure and oncotic pressure. Hydrostatic pressure is the pressure which takes the fluid outside. Okay, we call it outward pressure. And oncotic pressure, with the help of proteins, it keeps the cells inside the, it's called inward pressure. Inshallah, I'll teach you. Then what will happen? Vascular permeability, yani all these endothelium cells will open up, and these things will come out from here to the tissue space or extravascular space. Then the blood will start slowing, yani bati jiddan, and all those things will become okay. Now, okay, now one by one we'll take it. Now, what I told you, number one, transient vasoconstriction. Shufina, it is like this. Then suddenly there's a vasoconstriction you can see over here. Now this is the skin, right? The skin. Now on this area, the skin will look blanch. When there is blanching, I'll tell you what is blanching. Okay, it will look blanch. Now this is called transient vasoconstriction. Okay, vasoconstriction. Now what is transient vasoconstriction? The arterioles, number one. Irrespective of the type of cell injury, it can be anything. Immediate vascular response is transient, very little time constriction. I told you this is the blood vessel, and it will become like this. The vasoconstriction of the arteriole, small blood vessels, responsible for blanching seen after injury. So if there is a blanching, I'll show you the diagram. What do you mean by blanching? Yeah, like it's little slowing of the blood vessel, slowing of the blood flow, and that vasoconstriction will occur, and blanching will occur on the skin. Now it is very, very small. Mild injury, 3 to 5 seconds only, and severe injury, 5 minutes. Very, very small. Now this is blanching. Can you see this one? This is blanching. This is normal looking skin. So this area, the blood has become constricted. As I use some blanching. Okay. Now this was the first process we finished. Now second process, what is it? Now this vessel wall will become like this. It will become dilated. Okay, dilated. As I use some vasodilatation. Now this is persistent, mawjud fi kathir waqt, and come on, progressive. Okay. Now you can see persistent, progressive vasodilatation. Everything is given in the PowerPoint which I have given you. Many arterioles, but also affect small venules and small capillaries also. But usually the arterioles are affected. Vasodilatation results in increased blood volume. Now, for example, the blood is flowing like this. Now suddenly there is a vasodilatation, sir. Now there will be what will happen here? There is increase in the blood volume inside the blood vessels, sir. Blood volume. So this will cause redness. As I use some rubor. Now this will come in the examination. I will ask you what causes vasodilatation and how will it cause the cardinal manifestation. What is it called? Redness or rubor. And the temperature of this area is warm. It causes calor also at the site of acute inflammation. So two signs of the cardinal manifestation, redness and warmth, is caused by persistent vasodilatation. And for example, blanching is caused by vasoconstriction. Okay, remember, please. Okay, this is very, very important to remember, as I want you to remember. Okay, very nice. For example, now this is vasodilatation. Okay, this is a normal blood vessel, has a normal blood vessel. Now this is becoming dilated. Shuf, this become dilated. Now this area will become red in the skin and also warm. Yeah, sure, hot. Okay, you can see this area, all this area is become sure red and warm because of this vasodilatation. Okay. Now the third is the elevation in the local hydrostatic pressure. So hydro means water, right? Pressure. So what will happen when there is increase in the hydrostatic pressure? There will be outward flow, yani outward flow of the fluid, or outward flow and the of the things which is inside. So we call it transudation of the fluid. يعني ايش المويه في جوا الشريان والوريد يعني هو يخرج برا transudation or into the extracellular space or the tissue space. Now this causes edema and this is called transudate. Remember, very, very, very important MCQ every year. Okay, when there is low protein, we call it transudate. When there is high protein, we call it exudate. Remember, this we ask every year many times. Okay, high protein, exudate. Here, low protein. Okay, so it's called swelling at the local site of acute inflammation is called tumor, and that if there is swelling that will swell up, it's called tumor. Okay, now this this tumor is caused by another MCQ by increase in the hydrostatic pressure. Now you got to remember this word. هذا اصطلاح مهم جدا. Inside I'll teach you what do you mean by inward pressure or oncotic pressure. Okay, we go furthermore. Now this is hydrostatic pressure. In this the arterial end and this is the venous end. Okay, of a capillary. This is the capillary. Now this is the blood vessel, and this is the interstitial space or extravascular space or tissue space. Okay. Okay, now these blood, the blood cells and the fluid which is inside has to come out. When the hydrostatic pressure increases, the outward pressure will increase and the fluid will come out, forming edema. Okay, and the oncotic pressure, the osmotic pressure will make the fluid remain inside. It has the pressure of the causing inward pressure, inward pressure. Remember, okay. Now this with the basic physiology they will teach you, and this is called Starling hypothesis. I think the physiology professor like Dr. Jundi will teach you more common. Now this got to remember this very, very important pathogenetic mechanism of inflammation. Okay, now you can see this is from the Robbins, which I told you got to buy it. See, the hydrostatic pressure is the outward pressure and colloidosmotic pressure is the inward pressure, which keeps the fluid inside. So these are balanced. These are balanced, okay? And the plasma proteins are inside. Okay, now what is happening over here in inflammation? There is increased hydrostatic pressure, for example, due to venous outflow obstruction, or for example, we have a congestive heart failure after, for example, congestive heart failure after myocardial infarction. So what will happen? The hydrostatic pressure will increase and the fluid which is low protein content in few cells will go outside. Now, if you just take the stethoscope and put the stethoscope on the lungs, on the thorax, you'll hear some noise of the water. We call it crepitations. And this is due to increase in hydrostatic pressure. The fluid is coming out. So it is leaking out. So there's inflammation. Okay. Now, what is happening? These proteins which are inside has the power of colloidosmotic pressure to keep the fluid inside, right? Inside pressure. So this decreased colloidosmotic pressure due to decreased protein synthesis. For example, in liver disease and increased protein loss in kidney disease. So what will happen? They don't make, they don't manufacture the protein. So what happens? The colloid osmotic pressure will decrease and it will cause, instead of retaining the fluid inside, it will cause barra because of decreased osmotic pressure. So this will cause outward flow of the fluid. Now the main function of the protein is to keep the fluid inside the blood vessels. So there is a mismatch of the hydrostatic pressure and the osmotic pressure will cause edema. That is one of the most important component of what? That is inflammation. Now this is a very important diagram. Now this is normal and this is pathology. Remember, okay, what is normal? Changes in vascular leakage. by the Starling hypothesis. In normal tissue from arterial to venule, the intravascular hydrostatic pressure is same as equal to colloid osmotic pressure due to the proteins. It's same. So no fluid leakage. No fluid leakage, mashallah. So we are functioning normally. But what happens in inflammation? There is changes in the vascular permeability, vascular leakage. Why? In inflammation from arterial to venous, there is increased hydrostatic pressure. Yani the outward pressure is more. Increased hydrostatic pressure, that is outward pressure, and decrease colloid osmotic pressure, decrease in the colloid osmotic pressure. This causes edema. Now this is the important component of inflammation. Okay, so in the acute inflammation, what are you seeing? You are seeing cells barra plus edema. Oh, this is very, very important to understand. Okay, this was the, now you understand the vasoconstriction, mashallah. You understand the vasodilatation. You understand there's a elevated or increase in the hydrostatic pressure in an inflammation. Three things you have understood. Now the fourth and the most important thing is called increased vascular permeability. If you understand this, mashallah, 80% of the inflammation you will understand. Very easy, but very complex. I think I told you this is one of the most important events in a medical school in the whole of your 6-year course. If you don't understand cell injury, if you don't understand inflammation, you cannot understand any disease. Any disease. Okay, remember. So we are going to number 4 now. Okay. Increase vascular permeability. Try to concentrate over here. You can ask me questions. Even if you're ready, I can teach you for 2-3 hours, no problem. I have a lot of capacity to teach this one. I love to teach. Okay. Increased vascular permeability. Yani vessel wall becomes permeable to yakhruj barra our cells plus the edema fluid or the fluid. Okay, it becomes outside. So the increased vascular permeability is the hallmark of acute inflammation. So MCQ can come. What is the hallmark of all these things? A, B, C, D. D is the answer. Increased vascular permeability. Okay. But so this leads to escape of what? Protein-rich fluid. If it is protein-rich fluid, has a Usama exudate. And a yakhruj barra or protein-rich fluid has a Usama exudate. Okay. Is a can protein less fluid or protein less fluid is called transudate. 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 Very, very important. Okay. Now, the escape of protein-rich fluid or edema, exudate, and leukocytes in the extravascular space or tissue space is called increased vascular permeability. It is mostly affected is the venules, not on the arterioles. So this is responsible for again the swelling or tumor of any area in acute inflammation. So this is again MCQ, very, very important. Swelling is caused by increased vascular permeability. I hope you understand. Inshallah, in the future slides, you understand more. Shufina, edema, something coming out without much low protein or no protein is called transudate. Yakhruj barra. Okay, this is vasodilatation. Yakhruj barra are cells plus edema fluid, which is less in protein. This is called transudate. Okay. Now this is the, you can see a lot of cells over here, and the proteins are going outside. So protein-rich fluid. Usama is exudate. Edema is exudate. I hope you understand. It's very, very important. Now you can see over here, this is the diagram from which I told you to buy the book. Very, very important. This is normal. Now this is normal. What is it? Hydrostatic pressure is 12 to 32 over here, and the colloid osmotic pressure 25 over here. This is normal. Ma yakhruj fluid walla cells bara kullu shay jua. Okay, yeah, normal. Everything is going normal. Now we'll try to understand what is transudate and what is exudate according to your book. Yani, I told you when there is increased hydrostatic pressure, maybe due to venous obstruction of a very good is the congestive heart failure in the form of left ventricular failure. Now, when there is increased hydrostatic pressure, the fluid is going out, fluid leakage. Okay, and there is decreased colloid osmotic pressure, maybe due to liver disease or kidney disease. Okay, so there is no much protein, so they cannot retain the fluid outside. They will keep it outside. Now, this is transudate, very easy to remember. But what is happening over here in exudate? There's a fluid plus protein leakage. Yani protein leakage occurs, that is called exudate. This is a MCQ which comes every year, almost every year. Okay, there is dilatation of the blood vessels, the stasis of the blood vessel, and there is leakage of the proteins, leakage of the blood cells, leakage of the fluid outside, and this all due to exudate. Oh, this is a very important component of the inflammatory process. I hope you're understanding. Okay, now this you have understood. Now we have another important slide over here. Remember, now one of the most important slide for the examination. In the initial stage, the escape of fluid is due to elevation of the hydrostatic pressure. This is transudate in nature. I told you this one 3-4 times. Okay, but subsequently, the escape of fluid is due to increased vascular permeability. Okay, of the microvasculature. When there is increased vascular permeability, protein also will go out. Go out. Yani yakhruj barra. Hada yusamma exudate. Yani exudate is protein rich fluid. And what is transudate? Fluid which doesn't have much protein. Okay, or protein less fluid. That is the one. Now, transudate is due to increased hydrostatic pressure, and exudate is due to increased vascular permeability. 2 MCQ. Number 1 MCQ, transudate due to increased hydrostatic pressure. Exudate due to increased vascular permeability. Khalas, you'll get this, inshallah. I'm going to write this. Please remember. You remember this particular page, inshallah, you'll get the question. Okay. Now, this I just added to you. It's present in your PowerPoint also. That just to it's an extra vascular fluid, extra nafsu wahid. Shuf nafsu wahid, extra vascular fluid. Now you see exudate high protein. Shuf in a low protein. Antarif, that protein common is albumin. It contains cellular debris, lot of cells. It has little or no cellular material. Now this is super important. Exudate is having high specific gravity. Why? Because of high protein. Remember, this will come in the examination again, MCQ. Remember, and this has low specific gravity because low protein. Okay, very easy. Now this is seen as an inflammatory reaction. Usually, exudate is usually inflammatory reaction. Now this transudate is an ultrafiltrate of blood without an increase in vascular permeability. So here is vascular permeability. Here is only increased hydrostatic pressure. Increased hydrostatic pressure causes transudate. Increased vascular permeability causes exudate, and mostly seen in the inflammation. I think you people are clear with this, and there'll be no doubt about this. I'm very sure about that. Okay. Now, there are good example. This ultrafiltrate of the, for example, in the lungs, you can see this very clear fluid. Okay, due to congestive heart failure. Okay, or for example, or renal failure, the very clear fluid. This is called transudate, which is less in protein. You can see the fluid over here. This full of yellowish fluid, and is inflammatory fluid, and this due to increased vascular permeability, and this was due to increased hydrostatic pressure. Okay, and this due to rich protein over here. This is called exudate. This is a very good example. Okay, now we are coming to now this is the main event. Main event, as I already told you, in inflammation. What was that? This is the altered vascular permeability mechanisms. So we try to understand this particular event in 5 steps. Formation of endothelial gaps, direct endothelial injury, number leukocyte kuratadambeda, WBC mediated endothelial injury, then transcytosis of the cells, and the leakage of the new blood vessel formation. Yani you should have a division over here, right? Division over here. Now very, very important. Now we'll take one by one very clearly. Formation of endothelial gaps. See over here. Now I'll try to show you this one. 1, 2, 3, 4, and 5. Inshallah, such that you understand. We'll take the first one, formation of endothelial gaps. Okay. Now you can see over here. This is the skin. This is the bacteria, and this is the endothelial cells. Okay. This is the blood vessel endothelial cells with the nucleus. These are the WBCs inside, and this contains the fluid over here inside. Okay. Now you should have a number 1. You should have endothelial gaps. Okay. We go. Now, formation of endothelial gaps. This is an immediate and a very small transient response. Okay, the endothelium should open. Yani iftah al-bab. Yani nanu urid an yakhruj barra. Okay, this is the most common mechanism for increased vascular permeability. Very, very important for a formation of exudative fluid and what? And WBC barra. Okay. It occurs by contraction of the endothelial cell cytoskeleton. Okay. Now you can see over here, I try to show you. Okay. Now you see, now they started from the gaps. Shufina gaps. Yani iftah al-bab. Shufina gaps. Okay. Now what will happen through this gap? Fluid will come. That is a protein-rich fluid usually when exudate, and the cells will also come. Okay. So you have the edema fluid plus cells, that is WBCs. Okay, we go furthermore. Now you can see this from your textbook. These are the leukocytes, neutrophil inside. This is the endothelial cell. This is the nucleus, plasma proteins, endothelium. Now this retraction of the endothelial cell, Shufina, yani there is a iftah al-bab due to histamine. These are the, what do you call it? These are the mediators of inflammation. I'll try to teach you. For example, if you have inflammation somewhere in your body, you go to the Saidaliya and tell them to give clarinase. That is antihistamine, right? So antihistamine will try to open, will cause increased vascular permeability such that has a army jaish yakhruj barra lazim shub al terrorist. Where is the terrorist? Terrorist yani the bacteria wala shay. Okay. Now there's a very rapid and very short lived. So there's a retraction of the endothelial cells due to cytoskeletal changes such that huwa iftah al-bab. Shufina bab maftuh, sah? La zay kida. Okay, you can see over here very clearly gaps in the endothelial cells. Shufina, this whole of this endothelial cell, this is the nucleus, this contracting and opening the bab. You can see the fluid coming out over here very clearly. So these are the venules, and what are the mediators? You should remember this mediators called histamines and leukotrienes. We have anti-leukotrienes also, montelukast. You can go and find in the Saidaliya. This is the most common mechanism for increased vascular permeability is gaps to endothelial contraction. This is very fast and very short-lived. That is minutes. Okay. So you finish the endothelial gaps. Now you got to see direct endothelial injury. Yani they'll go and attack the endothelium itself. Okay. Now you see immediate sustained, but it is sustained and prolonged. That the this was formation of endothelial gaps were very, very short-lived. That's all finished. But direct endothelial injury is what? Sustained, yani istimrari and prolonged. Okay, remember that one. It is rapid but long-lived. Yani yakhud al-waqt. Okay, it occurs by a direct injury causing necrosis. Okay, and necrosis of the endothelial cells by toxins of the bacteria, virus, like that, as infections and sometimes the burns. So these toxins which are released by the bacteria go and attack the endothelium and causes injury, okay, to the endothelium. So all levels of microcirculation, including small arterioles, venules, are affected, including the venules, capillaries, and arterioles. So this actually we are reading the increase in vascular permeability. You can see over here, Shufina, this is the skin, this is the toxin of the bacteria going and killing and going and causing direct injury to the endothelial cells. Very, very important. You can see over. I made this diagram for you. Okay. Now this is the endothelial injury. Now the endothelial injury itself caused by burns or some microbial toxins will go and attack. And when this attack, they go and attack the endothelial cells. It is very rapid, very long, live for hours to days. It's called endothelial injury, which is caused by the toxins of the bacteria or viruses. Very, very important. Okay. You can see over here, this bacteria are causing injury to the Shufina injury, Hina injury, Haza injury, Shuf, causing due to toxins of the bacteria or viruses or fungus or even the parasites. Okay. Now, direct injury. Very important. Direct injury. It can be caused by arterioles, capillaries, and venules. All these toxins, Shuf, toxins go and injure the endothelial cells. It can form holes anywhere due to burns and chemicals and toxins of the bacteria. It is due to very long-lived and hours to days. Okay. Now we finish with the endothelial gaps. We finish with the endothelial injury. Now we are looking for the WBC mediated endothelial injury. Yani the WBC which is inside the blood vessel itself go and attack the endothelium. Shuf. It will go and attack the endothelium. Shufina. It will go and attack the endothelium. I'll try to show you this one. You can see leukocyte or WBC or Kuradadambeda mediated endothelial cell injury. It is delayed, prolonged, sustained response. Okay, sustained response. It is due to leukocyte, that is WBCs. Like what? Like what? like neutrophils and eosinophils and plasma cells, lymphocytes are activated and cause endothelial cell injury. Mohim jiddan. Many questions will come MCQs. It affects mostly the venules, mostly, and inside the lungs called pulmonary capillaries, and inside the kidneys called glomerular capillaries. Very important. Leukocyte mediated endothelial injury. Now, if you don't understand cell injury, if you don't understand information, you cannot understand any textbook of medicine, surgery, gynops. That's why I'm stressing so much. Knowledge is important. No examination, please. Examination, wallahi lazim, I'm telling you, has a cakewalk. It's easy for you, inshallah. Don't worry. You can see over here, this is the WBC, right? WBC. Now, this is going and attacking the endothelium itself. It causes injury to the endothelium itself. You can see over here, Shufina, how the WBC, transaction WBC, it is going and attacking the endothelium cell, breaking it. Okay? It's called leukocyte, WBC, dependent injury, usually in the pulmonary capillaries or the glomerular capillaries, mostly venules. Late response, usually living for hours together and long lived. This is very, very important to understand the increased, what do you call it? Sorry. This is the increased vascular permeability mechanisms. As that is the 5 mechanisms which I'm dealing with you now. Now you see the 4th mechanism is what? Now we finished with this one. I'll just go back. Okay, sorry. Yeah. These were the things. We finished with the endothelial gaps. We finished with the endothelial injury. We finished the leukocyte endothelial injury. Now we are going to the 4th mechanism, increased transcytosis. Okay, increased transcytosis, 4th mechanism of increased vascular permeability, again affect the venules rather than the arterioles. All the things major are occurring at the venular level. Yani has a varid or has a shirian, caused by formation of vesiculo-vacuolar organelles near intercellular junction maintained by histamine, MCQ, or vascular endothelial growth
Doctor,
factor. Yes, yes.
can you wait a minute when you write something? Because like the slide's coming very late for us. When you tell something like see here, and we can't see. Because like the slide
Yeah, coming
very late.
slowly, huh? Yeah, okay, I'll
Yeah,
wait.
you wait
I'll do
like
it.
3 minutes, or I meant 3 seconds, and it's will be okay.
Yeah, okay, no problem. Sorry. I'll just go back. Did you get this slide? Is okay for you? Leukocyte dependent injury is okay? WBC. This
If you
how does
repeat it in a quick way, we can understand it more.
yeah, sure. Now this leukocyte, which are the WBC, is inside the blood. Now this is the cross section of the blood vessel. If you take a cross section, this leukocyte will go and injure the endothelial cells. Okay, when they injure the endothelial cells, you have these holes, shufina holes and holes are making. Now when you make the holes, the WBC and the fluid will come out, right? Now these is the leukocyte or WBC dependent injury. Very, very important. It's usually seen in the lungs and the kidneys. This is called this one. Now this is the way this increasing the vascular permeability. I'll just go back just to show you that I'm teaching you altered vascular permeability mechanisms, and this is very important. The first one was formation of endothelial gaps. Second was the direct endothelial injury caused by the toxins. You remember the toxins? Okay. Now the third was the direct WBC mediated endothelial injury, which I taught you now. Now we are trying to see the transcytosis. Okay, that's what. Okay, I'm going to the transcytosis now directly, which we were discussing over here. Okay, now this is actually being affected in the venules, not the arterioles. Now this will cause organelle changes at the level of the endothelium. Okay, at the level of the endothelium. I try to show you the picture next in the picture, and this is caused by histamine, MCQ coming in the examination, or VEGF. VEGF is vascular endothelial growth factor, which causes increased transcytosis. Okay, this again in the slide you can revise, no problem. And when I finish this, I'm waiting for you such that I go after some time, 3 seconds. Okay, now this is increased transcytosis. What do you mean by transcytosis? Now this is formation of the holes. You can see all the holes in the endothelium. You can see the holes over here, holes. Now this will cause more hole formation, more holes creation in the, it's called transcytosis. Now this is usually in the venular side, not the arterioles. Now this is caused by VEGF. Now this is an MCQ. vascular endothelium growth factor. Now this is very important. So we finished with the 4 steps of increased vascular permeability. I hope you understood, right? I'm going back such that I just want to show you that this we finished it. Okay. We finished the endothelial gaps. We finished the direct endothelial injury by the toxins. We finished with the leukocyte mediated endothelial injury. This was the most important, I told you. And we finished the transcytosis by creating holes, okay, in the endothelium. Now, the fifth and the last one of the increased vascular permeability is leakage from the new blood vessels. Yani, they form new blood vessels. Yani, they form new shiriyan wal barid. Now, this needs mitosis, that is division of the cell. I will try to show you this one. So this I finished. I'm going forward now. Where I left from there, other transcytosis. I'm going now. Okay, we finished this one. Okay, we finished this one. Now we are going to this one. Now this is the transcytosis. You can see over here. Now this is creating this one, and all these cells will go through this one. Cells and the fluid will go through this holes. This was transcytosis. Now we have this. We finished the endothelial gaps. We finished the direct endothelial injury. We finished the WBC mediated injury. We finished the transcytosis. Now we are going to the new blood vessel formation by division. Okay, you got to know by mitosis. Okay, I go furthermore. 1, 2, 3 seconds. Okay, now this leakage from the new blood vessels. Now this leakage of new blood vessel will cause increase in vascular permeability. Remember, because I can guarantee you, if you read the textbook of Robbins, you can't understand. That's why I'm taking a lot of time for you to teach, because I told you cell injury plus inflammation is the key of your MBBS. Haza miftah lil kullu MBBS. You cannot understand a single disease. That's why I'm going slowly. I'm creating new slides for you to understand. Now this occurs at the site of angiogenesis. But what is genesis? Formation. New blood vessel formation. Okay, as the new blood vessels are leaky. Now this is again caused by the vascular endothelial growth factor. Okay, I stop over here. 1, 2, 3 seconds. Okay, we go to next slide. Now you can see over here new blood vessel formation. Hina shuf hada in a division, in a division, in a division, in a division, in a division. This is the division of the endothelium. Okay, endothelium. And you can see due to this one, new blood vessels are formed, and these are leaky. They become leaky. That is yakhruj barra al fluid and the as well as the blood cells. That is the WBC. Now the last is the slowing or stasis. That is what do you call it? The flow of the blood becomes bati jiddan, stasis. So this, when there is slowing of the blood flow, increased concentration of red cells will occur. So red cells RBC, Kuradatam Hamra, will make the raised blood viscosity. The blood viscosity will be raised, and this blood viscosity will cause more inflammation. So these are slowing or stasis. I think you understand very clearly. We go furthermore. Bismillah. Okay. Now you know this is the first step. This is the second step. This is the third step. There is leukocyte injury. This is the whole formation, and this is this division. So these are things which I have already taught you very clearly, and this causes increase in vascular permeability. Now I just put one diagram extra for you just to know this one. Now this is the bacteria. This is the bacteria. This is the bacteria which caused opening of the endothelial gaps, injury to the toxins of this one has also stopped and caused the injury to the endothelial cells, and these also attack the endothelial cells, and there was holes in this one and all this one, and new blood vessel formation will occur. So these are the things which occurred. Now you can see over here, I just put this one, the toxins causing injury, the holes are created, that the what is happening, this itself causes injury to the endothelial cells, and all this causes exudation or leakage of the fluid outside. Thus we are finished now. Now this is an important slide for the examination, and this is also given in your it's not given in your PowerPoint, but why I put this, because we ask questions. This is given, this is given, this is given. But out of the 5 I took only 3 because we asked question on this one. We ask about the endothelial cell contraction. We ask this question. caused by histamine and bradykinin. MCQ. I'm making the things very clearly. Okay. Now this is, I talk about the direct endothelial injuries. Huh? Okay, like in burns and bacterial infection. This causes leakage, lasts until vessels become thrombosed and repaired. Now this is, we can ask, direct endothelial injury can occur in burns and some bacterial infection. And this is the WBC, mediated or dependent endothelial injury, caused by, this is an MCQ, we call it toxic oxygen, toxic oxygen, oxygen radicals, okay, or proteolytic enzymes will cause this leukocyte dependent injury. So this is very easy. It's only a revision slide. Okay, you don't have to, that's why I did not give you, because these three mechanisms we usually ask in the examination. So you got to remember, the most important is here, histamine and bradykinin causes endothelial cell contraction. Direct endothelial injury is by the bacterial infections or burns. Leukocyte dependent endothelial injury occurs by toxic oxygen radicals. That's all. Very, very easy. Okay. Now, these are the things, just the revision for you. Before we proceed furthermore, I teach you about the formation of endothelial gaps. I teach you about the direct endothelial injury. I teach you about the WBC mediated endothelial injury. I teach you about the transcytosis. I teach you about the new blood vessel formation like the VEGF is the mediator which may. So this is the revision. Okay. Now with this, we finish this one. We are going into the cellular events. Do you remember acute inflammation as a revision have two events. One is vascular events, which we finished now, vascular events, and we are going to cellular events now. Cellular events. Now this is cellular events. What do you want to see over here? The main function of the increased vascular permeability and stasis is the delivery of the WBCs at the site of injury. مثلا شوف هنا، شوف هذا هو blood vessels صح. This is the endothelium صح? And the bacteria is over here. Now we need this particular WBC to يخرج برا and go and eat this particular bacteria or necrous tissue. So now we need to know, what do you mean by the cellular events? What do you mean by margination? What do you mean by rolling? What do you mean by adhesion? What do you mean by transmigration? What do you mean by chemotaxis? What do you mean by phagocytosis? هذا كله يسمى cellular events. Okay, you already know this. Now see, this slide is again very important. First is called margination and pavementing. Then the WBC will roll. The WBC will stick. يسمى adhesion. WBC iftah al-bab, called transmigration, and hijra. Okay, diapedesis. Then attraction by the chemical product, yusamma chemotaxis, then phagocytosis. So many MCQs. We can ask you very simple, like what is the routine mechanism? Margination, rolling, adhesion, transmigration, chemotaxis, and phagocytosis, right? So we will rearrange it. I can ask you which is the fourth step, which is the third step, which is the second step. So like that, you can easily make out. And like this, for example, you can see over here, this is the leukocyte, okay? And this is the margination. It goes to the margin, show margination. Then they start rolling over here, show rolling, okay? After rolling, they try to stick. And they use some adhesions. After sticking, they try to hijra. So we hijra, use some transmigration between endothelial cells and the surrounding tissue. That is the tissue space. Tissue space. And they got to go, suppose the bacteria is over here, and they go from here like that, and they try to do phagocytosis. Kullu yusamma cellular events. Now this is very important. If you don't understand this, you cannot understand even the what do you mean by drugs, and what drugs, what are the drugs, what are anti-inflammatory drugs, what are the non-steroidal anti-inflammatory drugs, what is Panadol, what is the Voltaren drug, why do you put the Voltaren gel on the skin, why you do this? It's anti-inflammatory. What do you mean by steroids, Jani? And the my arif is a can my arif hada shay. So this is very important. Inshallah, in the last, I'll take up many questions from you if you wait with me. Now, this one is very important. This is not in your text, but I just put it for you to understand. This is margination. Shuf, hada coming. margination. After this, they start rolling. Now, rolling is done by selectance, MCQ. This will come in the examination, just try to remember. Then after this, what will happen? Addition. Addition is done by integrins, MCQ. These are the cellular products will do it. And transmigration hijra is by PCAM1, MCQ. There's only three things. There's a lot in the textbook. I don't want to confuse you. A lot in the textbook. You can go and read the textbook, but I just put only three things. Selectance is help in the rolling. Addition is done by integrins, and PCAM1 helps in transmigration. This is the blood flow. Okay, now you can see this is the diagram I gave you, and also present in your Robbins. You can see over here. This is the leukocyte with all these glycoproteins. It is going and having the margination with the selectants. You can see over here, and the selectants. You can see the selectants. Do you see the selectants over here? I just put this question for you. So rolling is done by selectants. Shufina, very, very important. Okay, we go back. Now, you have this integrins, which is helpful in what? Addition. Integrins are helpful in the addition. Remember, this will come in the examination. Additions. Okay, PCAM1 is helpful in the transmigration. That is hijra. Okay. Now you remember only this thing. Selectants for rolling. Okay. And integrins for addition, which I already told you before, and PCAM for transmigration. I go back. Shufina, rolling selectants, additions, integrins, and PCAM for the transmigration. So this is present in your textbook very clearly. Okay, you can see over here, and here they go and eat it. This is called with the help of cytokines, they kill the bacteria. It's called phagocytosis. So this is emigration, chemotaxis, and phagocytosis. Very, very clear. Okay, now this is a very simple diagram. You can see over here has a blood vessel. Shub has a blood vessel. This is margination. Yeah, go to the margin. Okay, then this selectants will help in the rolling. Okay, integrins will help in the addition, that is sticking. PCAM1 for transmigration. Yakhruj barra. Okay, this is chemotaxis. This is phagocytosis. I hope that you understand everything now. I had 1, 2, 3 seconds. Before I just go, I'm giving 3 seconds. Now, this is actually again a revision slide, which I already give you. Margination around the endothelium, rolling for the selectants, and additions for the integrins, and integrins and transmigration for the PCAM1. Remember for this one, and chemotaxis, and that is phagocytosis. You already have this in your notes. Now, this is phagocytosis. You don't have to remember. Now, this particular cell this is the microbial receptor of the bacteria. It is being engulfed inside and is taken up over here. And after this a neutrophil engulfs inside, the phagosome is formed, and this bacterial product is ingested in the lysosome, and the lysosome and the phagosome fuse together, and in the nitric oxide, which are the mediators, and the oxygen species in the neutrophils will try to kill the microbes through the reactive oxygen species and nitric oxide. Now, this is very important. Reactive oxygen species plus nitric oxide will help in phagocytosis of the bacteria. Again, reactive oxygen species plus nitric oxide help in killing the bacteria by the process called phagocytosis. We call it killing and degradation. That's all. Very simple. Don't have to worry. 1, 2, 3 seconds. 1, 2, 3. Okay. Next slide. So you don't have to remember this one. What do you contain inside the neutrophil? I will not ask this. Don't worry. This is only for your knowledge. Neutrophil contains a lot of granules inside to kill the bacteria or virus or something. Okay. So these are called secondary granules and primary granules. Secondary granules are lysozymes, collagenase 4, okay, and plasma lemma. All these you can see over here. Specific granules and eosinophilic granules. And the primary granules are fusions and phagosomes and myeloperoxidase and NADPH. This will come in your what do you call it, SMLE examination of Saudi Arabia and USMLE of USA. If anybody is interested, then we can talk afterwards, not now. Acid and neutral protease. So these are the neutrophilic granules inside which kill the microbes. I already give you this in your notes, and that is enough for you. I hope that you'll understand this easy chapter. It's not a difficult chapter, but very important chapter. 1, 2, 3. Okay, you can see this revision, margination, rolling, adhesion, diapetesis, transmigration, phagocytosis, killing. Okay, margination, rolling, adhesion, or transmigration, chemotaxis, phagocytosis. It's very, very easy. Okay. Now we go to the second part, tissue injury. What are the chemical mediators? After tissue injury, what is happening? You can see production of inflammatory mediators. Very, very important to remember. Okay, like we have histamine, antihistaminic, we have clarinase, cetirizine, all such things. These are vasoactive mediators which mediate the inflammation. Okay, and we have chemotactic factors like complement factor 5. Very, very important. Okay. Then we have, now this one is an MCQ. Remember, MCQ. What causes increased vascular permeability? They will ask you. Tell it is histamine. Okay. And increased vascular permeability will cause edema. Again, MCQ. Remember, very, very important. Please don't get confused. Okay. Please. Listening. Okay. Recruitment of inflammatory cells. Now what is happening? The complement factors are recruiting more and more and more and more inflammatory cells. We need more Jaish. We need more military. Is a terrorist inside the Medina city or Makkah city? The police will come. The police will call the Jaish, the military officers, to cause acute inflammation, right? To catch them. Okay, this is very, very important. So they call more neutrophils. PMN means polymorphonuclear neutrophils. They call neutrophils. Very, very important. Okay, you can see over here, we have written down there also, and they recruit more inflammatory cells like neutrophils and eosinophils for hassasiyah, maybe basophils like that. Okay, now we go furthermore. Chronic inflammation we call monocytes or macrophages. Macrophages. I think the things are becoming little clear for you now. Okay, so these are called the inflammatory mediators. We need to read more of it. Inshallah, we have the slides over here. Now you have chemical mediators of inflammation. This is again very important. We need to read it more. And the slides over here are chemical mediators giving very, very important. Now you can see over here. Now this is very important. Remember, chemical mediator inflammation is some mediators are plasma derived and some are cell derived. Remember, Mohim Jiddan. Mohim Jiddan. Okay. Now, plasma derived are complement mediators, coagulation mediators, and kinases. Okay. And cell derived are the histamine, which I told you. Histamine is secreted by the mast cells. Again, an MCQ. Okay. And the cell derived, they synthesize the prostaglandins. You know our Panadol. Panadol is anti-prostaglandin. You should know it. Okay. So these are plasma derived. These are produced by active precursors, which are active at the site of inflammation. So you should know the mediator, either it is plasma derived or either it is cell derived. Cell derived like mast cells, histamine, and synthesized by the cells called prostaglandins. Okay. Now again, these are the cell mediators. Okay. Some are preformed like histamine and serotonin. We have antihistaminics. We have anti-serotonin. And newly synthesized like prostaglandins, leukotrienes. We give the montelukast and the bronchial asthma. We have platelet activating factors. These are all the mediators which we ask in the examination, are very important for your treatment processes, are very important for diagnosis. Okay. We have reactive oxygen species, which I just told you. We have nitric oxide. You remember reactive oxygen species and the nitric oxide, they degrade and kill the bacteria and cause phagocytosis. We have a lot of cytokines and neuropeptides. These are all the mediators of inflammation, which are very, very important. Among the most important is the histamine over here and prostaglandins. Very, very important. Try to remember. Okay. Now, plasma derived. We'll take first plasma derived. Then after that, we'll go for the cell derived. Okay. We are taking plasma derived. Then we'll go for the cell derived. Plasma derived. What are those? Clotting system, complement system, kinin system. So these are the plasma derived proteins or plasma proteases, which are produced in the liver. They are plasma derived proteins and complement. Now, for example, we have a complement 3A, complement 5A, complement 3B, and we have a membrane attack complex Usama C5 and 9. Okay, we call it membrane attack complex. So these are complement mediators which are helpful in inflammation. We have factor 12, Hegman factor. causing production of bradykinin. Again, a very important mediator of inflammation. Okay, just try to remember bradykinin. Okay, that's all. And these are the plasma-derived mediators of acute inflammation. Very, very important. I just go back so that I don't get confused. This is the plasma-derived complement coagulation factors kinins. This was a good example was bradykinin. Okay, and cell-derived we'll try to see now. This I teach you very clearly, and now we go furthermore. We have action of chemical mediators, right? Now this is very important for the exam. Vascular dilatation, you remember? The first was vasoconstriction, then we have vascular dilatation, remember? Now this is mediated by histamines, number one, by prostaglandins, by C3A and C5A, and nitric oxide. You got to remember this one. There's vascular dilatation. Remember, then the next step was vascular permeability. You remember? All this have gaps and everything is coming out. Now this is again made by histamine, serotonin, and this is very important, leukotriene. We have leukotriene C4, leukotriene D4, leukotriene E4. We have anti-leukotriene drugs in the cythalia. This we have again prostaglandins. We have kinins, like an example is bradykinin. Bradykinin. Okay. Now these are the chemical mediators which mediate the vasodilatation and vascular permeability. Okay. Now we have action. Now they will ask you again in the examination MCQ, what causes fever? Fever is caused by interleukin 1, interleukin 6, tumor necrosis factor, and prostaglandins. Try to remember this. They might give you all of the following causes fever except one. So something new will come, maybe cytokines or leukotrienes. That is the and chemotaxis, you remember? First is margination, then the rolling, then adhesion, then transmigration. After going out, we have chemotaxis. Chemotaxis is maintained by leukotrienes. Very important question. Lysosomal components, cytokines, and we have C5A and the bacterial products. These are all the chemotactic mediators. Okay. Now, actually, we have finished the vascular events very nicely of the inflammation and even the cellular events. Now we are trying to understand the mediators which mediate the vascular events, which mediate the cellular events. I think things are becoming a little clear for you. Okay. We go furthermore. 1, 2, 3. Now you see pain. Again, an MCQ which comes in the examination. These are all given in your notes. Okay. Pain is caused by prostaglandin and kinins. Very important. They ask mostly many times. If they give me the chance, I'll ask the question this one. That's why I'm telling you, very, very important. Now, tissue damage. Remember what happens? I told you in inflammation, either there's a bacterial infection or necrotic products or some virus infection. So this necrotic products cause tissue damage. The tissue damage is caused by oxygen metabolites, lysosomal components, and nitric oxide. Nitric oxide, very important. They ask always about the tissue damage is mediated by a mediator called nitric oxide. Remember, okay? Nitric oxide causes tissue damage, which is a mediator of chemical mediator of the inflammation. 1, 2, 3. 1, 2, 3. Okay. Now, what is the outcome of inflammation? Now, which is very important. You remember there's a tissue injury. Okay. Blood vessels become activated, or the inflammation, the reaction of the vascularized tissue to the blood vessel, and the blood vessel vascular events took place, the cellular events took place. Okay. Now, what is the function of acute inflammation? I told you after tissue injury, to make the cell repair or make it normal. Okay, to the tissue. Okay. Now, what is the outcome of inflammation? Very important. The first is to be back to normal. To get the normal tissue, it's called resolution. Now, this is MCQ. What do you mean by resolution? Back to normal. How's the MCQ? Limited or short-lived, little tissue destruction, and there is a regeneration. Again, 1, 2, 3, 4 times. What do you mean by resolution? It means regeneration, to getting back to normal. How's the Usamma? This first outcome of acute inflammation. What is the second outcome? Healing by connective tissue or fibrosis. For example, you have this heart and there was a myocardial infarction. Okay, you cannot get a new tissue. So this will become fibrosed, right? Fibrosed. This becomes fibrosed. Now this is very, very important. Now, fibrosis, this causes healing by connective tissue. Tissue incapable of regeneration, so they go for the fibrosis. Abundant fibrin and exudation in tissue and serous cavities causes the pleura to become fibrous, the peritoneum to become fibrous. So number one is regeneration or resolution, or you get the normal tissue. If you don't get the normal tissue, there's healing by fibrosis with the help of collagen. Remember, collagen. Remember. Now the third one, it can progress. The acute inflammation can progress to chronic inflammation. You remember, chronic inflammation is maintained by monocytes or lymphocytes. You remember in the starting, when acute inflammatory cells response continues, it is not stopped, going on and on and on. It goes to chronic inflammation. As a result, either persistence and istemrarian of the injurious agent occurs. So these are the outcomes of inflammation. The very important topic. Again, the same slide, but more clear in the from the textbook. What I told you to buy: injury, inflammation. You can see the vascular changes, neutrophils recruitment, all this thing. It can become normal. You Samayesh, resolution, yani regeneration, yani normal, replacement of injured tissue, normal function. Okay, clearance of mediators by acute inflammatory cells. Okay, this is, if it is not becoming normal, this can form an abscess, pus formation, fisadi jua, or it can go for healing by fibrosis. Shufina, fibrosis, healing by fibrosis. Okay, if it progresses, it can progress to chronic inflammation, like new blood vessels are formed, mononuclear cells like lymphocytes or macrophages are coming, and we get a fibrotic scar, or fibrotic scar formation. Okay, now this will cause it. This injury can be bacteria, infection, toxins. Here for chronic inflammation can be viral infection, any chronic infection, persistent injury, autoimmune. So this is the outcome of acute inflammation, which is very important for to end the chapter of this information before we go to the chronic inflammation. So 1, 2, 3. 1, 2, 3. I don't want to miss you something such that somebody told that things we miss up. Okay, next slide. Now we are going to chronic inflammation, the second part of the inflammation. This is very small. Maybe it will take 20 minutes or less. We can finish the chapter. And inshallah, then we can have a closing. Okay, definition. Now, chronic acute inflammation was short duration. This is long duration, weeks and years. Okay, inflammation continues. Tissue injuries is becoming chronic, and healing occurs at the same time. Remember, inflammation, tissue injury, healing at the same time. Yusamma chronic inflammation. Very important. Okay, 1, 2, 3. Okay, this is present in your PowerPoint. Now the slides, I just got it for your understanding. I told you I'm teaching for you to understand the information. Now this is I put in the summary of the chronic inflammation. What is it? It's a prolonged duration, the weeks or months. It contains continuous inflammation. It goes for tissue injury, and it attempts for repair formation. Shofina, inflammation continued with the help of monocytes and lymphocytes. Tissue injury continues, and repair occurs by fibrosis. So this is actually the summary slide of what I told you before. Okay, chronic. What are the causes? Esh al-asbab lil chronic inflammation. Why there is chronic inflammation? Why it doesn't stop at acute inflammation? Because the infections are persistent. यानी في इल्तिहाब इस्तेमरारियन मौजूद في الجسد, it goes to protect for the chronic inflammation. For example, tuberculosis, fungi, they are not killed. They are not killed by phagocytosis. They are موجود. هذا موجود دائما فالاستمراريا كثير وقت. Okay. Number 2, prolonged exposure to toxic agents, like you have a silica, you have asbestosis, and إذا كانت الشغال في الواحد شركة هناك في يعني plastic problem, silica problem, or there is a atherosclerosis in the blood vessel, continuous inflammation. So prolonged exposure, this causes chronic inflammation. Then number 3 is immune mediated disease like autoimmunity. Daiman mawjood antigen antibody reactions. Remember, antigen antibody reaction causing rheumatoid arthritis, Addison's disease, or there is hypersensitivity to hassasiyah, to immune response against common environmental substance like bronchial asthma. Bronchial asthma aslan yani huwa aslan hassasiyah. Okay, due to exposure of the continuous immune mediated hassasiyah, what will happen? The inflammation will become chronic. It will be persistent. That's why you got to give drugs to this particular patient. Okay, we have the cells. Very easy. We have the cells for Hassassia. We have eosinophils. Plasma cells to make the antibodies. We have macrophages. So the cells of chronic inflammation are lymphocytes and macrophages, and sometimes eosinophils for the Hassassia. You can see over here, these are macrophages. These are this brick like red color are eosinophils, and this is a plasma cell. Plasma cell will be like this. Okay. For example, you have in the bone marrow the monoblast. It will make the monocytes. The monocytes will make the macrophage in the extravascular space. And when there is a injury or it is infected by some toxic substance from outside or an what do you call it antigen from outside, this macrophage becomes activated, and this activated macrophage becomes epithelioid cell, and these epithelioid cells will cause formation of granuloma. As I told you, the special form of chronic inflammation I will show you now, okay, on activation. So what happens now? We have T and B lymphocyte. These are again very important for chronic inflammation. Chronic inflammation. Okay. Now, for example, you have as what you call this adaptive immunity, right? Adaptive immunity. What will happen? The antigen presenting cell, like macrophage, will get the antigen and it will present to the T cell. What will happen? The antigen activated macrophage or dendritic cells will go and activate the T lymphocyte. So macrophage release macrophage. So this will release the cytokines. They'll go and attack the lymphocyte, and the lymphocyte will make a lot of cytokines. Cytokines will activate the macrophages, and this T lymphocyte will activate more T lymphocytes. So T lymphocytes will make more tumor necrosis factor, and more inflammation will occur. This chronic inflammation and interferon gamma will make more macrophages, and this inflammation of tumor necrosis factor and interleukin, that is the cytokines, will make more chronic inflammation. So in chronic inflammation, what is happening? The antigen presenting cell, the macrophage or the dendritic cells, will present to the T lymphocyte. T lymphocyte will become activated, will make more activated T lymphocyte, will cause release of this cytokines in the form of tumor necrosis factor, interferon gamma, and will cause recruitment of more macrophages and lymphocytes for making up of the chronic inflammation. This is the idea basically of the T and B lymphocytes, such that I want to wait, such that I go furthermore. Now, plasma cells. So we have the T lymphocyte, and they will activate the B lymphocyte, and B lymphocyte will make the plasma cells, and the plasma cells will make the antibodies. Remember, antibodies. Okay. These are for the specific immunity or adaptive immunity, not the innate immunity, adaptive immunity. Okay. Like we had, you remember during the COVID, we have a vaccine, Pfizer vaccine, which was actually having the preformed antibodies. So they are terminally differentiated B cells. What are plasma cells? They are terminally differentiated B cells. These B cells will produce antibodies. So these are actually seen in the chronic inflammation, not in the acute inflammation. Okay. We have eosinophils for Hassassia, found in the parasitic inflammation, that is for Tufeliat, very important for examination. And this Hassassia is maintained by IgE. Now, this is again an MCQ in the examination coming almost every year. You can see all these are eosinophils. Okay. Now we come to a granulomatous inflammation. This is a special form of inflammation. Okay. In the special form of distinct pattern of chronic inflammation. Now, this is present in your, what do you call it? In your PowerPoint I gave you. It's very easy. It's a special form of chronic inflammation or distinct pattern of chronic inflammation. Macrophage is the main player. And this macrophage becomes activated and becomes epithelioid cell. And this I will ask you in the examination. Epithelioid cell. So anybody ask you what is epithelioid cell? Tell it's the modified macrophage seen in granulomatous inflammation. There's a focal area of inflammation made up of macrophages, lymphocytes, and plasmas. You can see over here, this is the necrosis. This is the giant cells made up of. The giant cell made up of what? Epithelioid cells. And here you have all these lymphocytes, and here you have fibroblasts. I'll show you this. This is actually present in your PowerPoint, easy, but I added many more. Now this is also present in your PowerPoint. Now these giant cells, they will ask you, what do you mean by giant cell? These are clusters of altered macrophages. Altered macrophage is called epithelioid cell. Remember, epithelioid cell. Epithelioid cell is like ship. like ship. Okay, macrophage is like this. Okay, when they convert, they become like ship. Okay, epithelial cells, and these are the cells for granular inflammation. MCQ, inshallah, I will ask you this one. And this clusters of altered macrophages or epithelial cells which engulf and surround indigestible foreign body like mycobacteria, silica, and suture material, and they become chronic inflammation or granulomatous inflammation. Now, we will ask every time, what do you mean by epithelial cells? I told you epithelial cell is a modified macrophage, changes their morphology and resembles epithelial cells. They say epithelial cells. That's why I call our Arabic for the students is looking like an epithelial cell, but they are like ship, right? Very, very important. These are modified macrophages. Now, this is actually the one. This is the epithelioid cell. Okay, these are giant cells. Okay, these are the lymphocytes, and this is the fibroblast. So this is the granuloma for you. So nice, granuloma. Somebody asks you what is granuloma made up of? Tell it is made up of epithelioid cells. Epithelioid cells. It is made up of giant cells. It is made up of lymphocytes. It is made up of fibroblasts. Aza hua. Yusamma granuloma. Another diagram. This is only for your teaching. That's all. Granuloma made up of Langhans giant cell shuf as a giant cell. Okay, clusters of epithelioid cell shuf surrounded by lymphocytes. Okay, and this is the necrosis inside. If there's caseous necrosis, it is called tuberculosis. Is seen in tuberculosis. MCQ. Where I will ask you in the examination, caseous necrosis seen in only in tuberculosis. Remember, tuberculosis. Okay, this is amorphous granular debris of the material, complete loss of cellular debris. And these are the, you can see the ship like cells, ship, epithelial cells with pale elongated nuclei. And outside this, you have fibroblasts. Okay, all these fibroblasts are there. And this is called granuloma. Very important. Okay, what are the causes? This is present in your PowerPoint. Different causes of granulomas. The common is tuberculosis, leprosy, syphilis, sarcoidosis, Crohn's disease, foreign bodies. They will ask you in the examination, one of the following is will form granuloma. All of the following will form granuloma except, and you got to remember this. Remember, and if you see the slide 2 or 3 times, you'll remember it. Okay, we will not ask you more than that. Exam will be easy. Don't worry of the examination. I have the maximum khibra in our medical college. So don't worry. I want you to become a good doctor. Okay. Now this one, I just added to you not to confuse you that this formation of the whole granuloma over here. Shufina, epithelioid cell, giant cell, fibroblast, lymphocyte, activated macrophages. All these are making from the activated macrophage, and modified macrophage will make an epithelioid cell. Remember, okay, epithelioid cell or modified macrophage. To sum what is called epithelioid cell. This is the granuloma basically. Okay, now this is the pathogenesis. For you to understand, I did not give you in this one just for your understanding. For example, you have a poorly degradable antigen or in the body. So macrophage engulf the antigen, but they cannot kill it. They cannot kill. What do? They try to destroy it, but the antigen is poorly degradable. So these cells in a macrophage fail to digest and degrade the antigen. What do? They take it to the CD4 T lymphocytes. I told you, macrophage fail to deal with the antigen. They cannot kill, because we are eating what? Chronic inflammation. They are present to that CD4 T lymphocytes. T lymphocytes become activated, and they release lot of lymphokines. We call it cytokines also. Okay, cytokines. And cytokines are interleukin, interferon gamma, tumor necrosis factor gamma. These 3 you remember for your not for your exams, but for your understanding, because in pharmacy and pharmacology we got to read this. Okay, now this is the slide. If you want to take a screenshot, or you want to, I think somebody is copying this, it will be very nice. So interleukins stimulate T cells. Interferon gamma activates macrophages and transforms them to epithelioid cells. So if I ask, epithelioid cell is formed by, remember, interferon gamma. MCQ. TNF alpha or tumor necrosis factor alpha promotes fibroblast production. Now this is very important. Again, this slide is important. Again, T cells are proliferated by interleukins. Okay, Epithelioid cells are made with the help of interferon gamma, and fibroblast production is made with the help of tumor necrosis TNF alpha. This is called cytokines. Very, very important. Okay. Now, I told you the definition of granuloma. Again, I want to tell you such that you become perfect. A granuloma is the focus of chronic inflammation or a special type of inflammation consisting microscopic aggregation of macrophages, okay, that transform into epithelium-like cells called epithelioid cells. Again, epithelioid cells are modified macrophages. Remember, I usually ask this in the examination. Okay, frequently these epithelioid cells when they fuse, they form giant cells, which are seen in the granuloma, and surrounded by a collar of mononuclear leukocytes, principally lymphocytes and plasma cells. That's all. Okay, you can see over here ship Juva, modified macrophages Juva, and you can see the lymphocytes over here. Then you have this all together giant cell, and in the corner you have a fibroblast. And this is the diagram I already showed you before. Okay, now caseating granuloma in the examination is seen in tuberculosis. You can see gross pathology, you can see cheesy like material, caseating necrosis, granulomas with a necrotic core, usually seen in the tuberculosis infection. MCQ will come. And non-caseating granulomas are seen in sarcoid. Okay, that's all. We go furthermore. We have a foreign body granuloma. Somebody sometimes eats something or something goes inside the lungs. We have a foreign body granuloma. In that around, we can see a lot of epithelioid cells, plasma cells, lymphocytes, and fibroblasts. Okay, what are the systemic manifestation of inflammation? Somebody has inflammation. Okay, let it be acute inflammation or chronic inflammation. The patient will have fever, the patient will have chills. All the acute phase reactants will be increased, like ESR will be increased. The Soviet tahleel, Usamma erythrocyte sedimentation rate, this will be more than 10 millimeters. Okay, and when you see, try to look for interleukin, Mawjood, and tumor necrosis factor Mawjood if you do a test for this one. And if you do cytokine effect like tumor necrosis factor alpha and interleukin 1 is also present. So these are non-specific systemic manifestations seen in all inflammation like acute inflammation and chronic inflammation. So this is very, very important for you to remember. Okay, what are the different morphological patterns of inflammation? Inflammation can be serous inflammation, fibrinous, purulent, ulcers, and others. Okay, serous inflammation, when the fluid inside becomes serous, you should zay moya. Okay, plasma looking like a effusion inside. It's like a skin blister. Other you some serous. It looks like a watery inflammation. Okay, it looks like a watery. We have fibrous inflammation within the body cavities or in the meninges and the pleura. We have a reddish type of reddish. We have fibrin. Fibrin is pinkish. You can see this pinkish over here, all this pink. Histologically, fibrin appears eosinophilic. We call it pinkish eosinophilic inflammation. Okay, all these threads are some of fibrinous inflammation seen in meninges and pericardium and pleura. Remember, if you remember pleura and pericardium, kifaya jiddan. Okay, suppurative yani sadid. Okay, sadid yani pus, yani purulent. Suppurative, kullu mutaradifat. Sadid, suppurative, purulent, pus. Okay, you can see the pus over here. The production of pus and a purulent exudate consists of lot of neutrophils and necrotic material and edema fluid as a kullu yusamma purulent inflammation. Okay, and you can see this in a good example is an abscess. This will ask in the examination. Abscess is the example of A, B, C, D. Can be, I'll write serous inflammation, fibrinous, or suppurative. It is suppurative. Okay. And one of the last one is the ulcerative inflammation. There's a discontinuity of epithelium or skin yusamma ulcer. The local defect of the surface of an organ or tissue yusamma ulcer. You can see the local defect over here produced by the sloughing. You can see the sloughing, shedding of the tissue. All this necrotic tissue has the yusamma ulcer. Okay, you get the ulcers on the leg, yusamma stasis ulcers. You get the ulcer in the stomach, for example, you have a peptic ulcer. So ulcer is the discontinuity of the epithelium or the skin or a local defect of a surface. Or the last slide for today is the pseudomembranous colitis, is again a special pattern seen in the intestine. Or there's a gangrenous inflammation, people who smoke a lot of smoking dukhan, and you get this, all this tissue becomes putrefactive and dead. It's called gangrenous necrosis or gangrenous inflammation. So you have special form of 6 inflammation. One, what is that morphological pattern? Serous, like watery in the blisters. We have a pinkish or reddish in the pleura and pericardium, fibrinous inflammation. We have suppurative in a pus or an abscess. Okay, we have ulcer in the leg or the peptic ulcer in the stomach, a local defect, and we have a special pattern pseudomembranous colitis due to use of antibiotics. If you use antibiotics for a long time, you get this pseudomembranous colitis, and we have, when you smoke a lot, you can get this gangrenous inflammation on the foot. Okay, now this was the thing which I have drawn. That is the end today. Okay, if you have any questions for 1 hour, I will take up. For 2 hours, I'll take up. I want you to understand very nicely. Okay, anybody want to ask any question? I hope it's easy, and only don't be get confused. Only that PowerPoint slide which I send you is is for the questions will come from that only. And if you have any doubts, you can put the questions on my WhatsApp, and this recording you can listen to what 2-3 times. It will be very, very clear for you. Anybody, Rami, want to ask anything?
Doctor.
Yes.
I didn't understand the granulocytosis inflammation. What's the difference between giant cells and epithelial cells?
Very nice. Good question. I appreciate. Okay, I'll give you an example now. Okay, 1 second. I'll add one slide for you. 1 second. I'll add two, 3 slides. Okay, we'll go. Yeah. Can you see the screen?
Yes.
Yeah. Okay. Now this is a macrophage. Okay, this is a macrophage. This has a nucleus. Now, when this becomes activated, good question. Whoever is there, I appreciate. This becomes like this, like an epithelial cell. That's why we call it epithelioid, or I told you ship. This macrophage becomes activated. It becomes modified. Okay, and it becomes epithelioid cell. Okay, epithelioid cell. Okay, when these epithelioids become one big cell, okay, this is called a giant cell. Giant cell. Okay, now again, what is a granuloma? Okay, granuloma is a special type of chronic inflammation made up of epithelioid cells, okay, giant cells, sometimes necrosis in the middle, and we have lymphocytes, we have fifth plasma cells, and in the corner fibroblasts. Okay, this is all called granuloma. I hope you understand. Fina, I'll show you this one. This is very clearly right. Here you can see this is the epithelioid cell, and these are epithelioid cells connecting. It becomes giant cell. These are the lymphocytes, okay, and plasma cell, and this is the fibroblast. This is called granuloma. Okay, good example is again epithelioid cell here, epithelioid caseous necrosis, giant cell, lymphocytes, and you can put over here fibroblast. The kullu mabad yusamma granuloma. Is it clear now?
So the granuloma is a multiple things, not one thing.
Granuloma is like a ball. Zay kurra yani. Sagir kurra. And it's a ball-like structure which is made up of epithelioid cells, giant cells, necrosis, lymphocyte, plasma cells, and fibroblasts. This is a special form of chronic inflammation. Okay, chronic inflammation, and especially seen in tuberculosis, sarcoidosis. Okay, I gave you a lot of examples. Syphilis in a chronic inflammation where you have granulomas.
But there is the macrophages who fail to do macrophytosis.
Yeah.
It's called giant cells or epithelial.
There's a non-degradable non-degradable antigen. Okay. Now macrophage, what does it do? There's a macrophage over here. It tries to kill it, but they don't get killed up. So they go to the T lymphocyte, T cell lymphocyte. The T lymphocyte will become activated. Okay, become activated. Now T lymphocyte will secrete cytokines. like for example interferon gamma. Okay, now this will make the macrophage into a ship or epithelial like. Then these will become activated or modified macrophages, and these are very important for granuloma formation. So these epithelioid cells are seen only in chronic inflammation. Remember, not in acute inflammation. Okay? Understand?
Understand. Thank you.
Barakallah. Any more questions from the girl side, from the boy side? I hope you understand. This is what I told you. If you don't understand cell injury and inflammation and neoplasia, whole of the medical college study you cannot understand. That's why it's very, very important. So I want you to read. You have to buy this book. Sorry to say, buy this particular book which I told you in the starting. This book and read. Start reading it. Read these chapters: cell injury, inflammation, hemodynamic disorders, genetic pediatric disease. No, this is not very important now, but you can read afterwards. But now 1, 2, 3, immune system, neoplasia. Now at least read this 5 chapters from 1, 2, 3, 5 and 6. Inshallah, you will be a good doctor. Because if you don't read this in detail, you don't understand disease of this, all this lung, kidney, skin, central nervous system, all these things. You don't understand. And if you don't understand anything, just take a photograph and send to me on the WhatsApp. I will answer you through the voice message, or you can come in a Zoom for 4 to 5 minutes with your 2 or 3 people. Alhamdulillah. Okay. Any questions more? Don't worry about the examination. I want you people to understand each and everything. لازم تعرف كل اصطلاحات باللغة العربية ولا اللغة الإنجليزية يعني. I can even speak in Arabic, no problem. I have 26 years in مدينة منورة, so ما في مشكلة. أيوة تتكلم وتتحدث وتنطق وتتكلم بالطلاقة باللغة العربية, كل اصطلاحات ما في مشكلة. But since the books are written in English, we got to tell you in English totally. So that's the idea. Okay, you like this small video? It's very clear, sir. Okay, Ustad Rami.
This is clear. Yes,
Yeah.
doctor.
So shall we continue or stop?
It's up to you, doctor.
We can stop now. Okay, well, I finished this this thing, and whatever small PowerPoint I gave you in 69 slides, that is enough for the examination. And you can give my phone number to everybody who wants to take it and want to keep it like that. For example, I'll also write it over here. People want to take up, and they can, contact me on WhatsApp for the questions. 0 5 0 4 4 1 0 1 3. Inshallah. Any question, any pathology, inshallah, I'll try to answer it. This is my job, it's my duty. Yani. As a fard in the law, inshallah. As a amana. Okay, barakallahu fikum.
Thank you, doctor.
I close.